Okay, we have with us Denise DiDonato. She is the Business Development Manager for UH Hospitals. Now, that's Conneaut and Geneva? Or
Yes,
is that...
yeah, that's Conneaut and Geneva Medical Centers.
Okay, now what does that entail, besides emailing me once in a while?
Well, it's a lot of different things, actually. I work with the community outreach team on all the community events that we have going on. I work with our new physicians that we bring into the community, making sure they're onboarded, oriented to the other physicians in the area, get the introductions made, and business development, anything that comes in new at the hospital, any improvements we make, any service lines we add. I make sure that everybody in the community, as well as the physicians' offices, are aware of what's going on.
So it's rather all-encompassing.
Yeah, a little bit. Yeah, a little bit. It's never a dull moment.
Now, I know a few years ago that getting new physicians in Conneaut wasn't particularly easy. How is that now?
Actually, it is going really well. This is a very exciting time for us. We actually have a couple new physicians that have, actually 3 new physicians that have started recently in the last 3 months. We've got Dr. AJ Kumar, who's over at Conneaut Primary with Dr. Abby. He is an internal medicine doctor as well, and he also sees patients in the hospital. So say, your doctor doesn't typically, visit you when you're in the hospital. Dr. Kumar would be the doctor who would be able to follow you when you're admitted. We also have Dr. Jessica Milliman, who is a podiatrist, and she is in Conneaut on Thursdays, but then she's in Geneva on Mondays, and she is in Ashtabula Tuesdays and Wednesdays. So she strictly does work for both of our hospitals.
Okay.
She does surgeries, procedures in Conneaut on Thursdays as well.
So when she's in Ashtabula, she is in the plaza there on Lake Avenue?
She's in the health center on Lake Avenue,
okay.
Correct. Yep. And then our newest physician that we're really, really excited that we were able to bring in is Dr. Perry Allwer, who
he was here the other day,
yes. Yeah. He is a GI doctor, so you could see him for any type of intestinal issues, whether you're due for a colonoscopy or you're having issues with maybe heartburn, acid reflux, irritable bowel, Crohn's disease. He would be the doctor that you would see for that. And he's in Conneaut on Thursdays as well, and Geneva's Monday, Tuesday, and Wednesday.
Right.
So we've been extremely fortunate. We've been able to really start recruiting some really talented physicians to Conneaut.
He was talking about it's been, can't remember, like 10 years since somebody was in Conneaut.
Yeah. So we're excited, and we are. He's not, he still has plenty of openings for new patients. He is seeing new patients right now. But we want to get him busy and keep him busy because we know there's a definite need in the area for that.
Yeah, there was, don't remember the circumstances, but somebody called and asked about something, and he gave it looked like a good explanation, and she says, I wish I would have talked to him.
Yeah. Well, there's some procedures that can be done. I was actually here when they asked that particular question, and she was questioning a little more risky procedure that a doctor was recommending, and he said, well, there are a couple other things that I can help you look at before that. We may find the end result is, yes, you do need to have that done, but I would be happy to see you prior to that to evaluate any other options that are less invasive.
So hopefully everything worked out.
Yeah, I don't know. I told him after we were done, I said, you might have stole a patient, but but it's always what's in best interest for the patient as well.
Absolutely.
If somebody's a little leery and worried about a procedure, the best thing to do is always get a second opinion or look at your other alternatives as well.
Yeah, it's always, I keep saying this, but it's always a new experience for the patient. The doctors, they know what they're doing, and the people in the hospital. So it's, but it can be scary for the patient.
Oh yeah, definitely. Yeah, for them it's something they do every day, especially if you're an ICU nurse or an OR nurse. You're used to the certain protocols and the things you do every day. But one of the things that our nurses are really great at is the compassion that they show for their patients, knowing that this may be your first time ever having surgery, and it's definitely a learning experience.
My first surgery was at the hospital at Dr. Seed's, and it didn't turn out too bad.
Oh, that's good.
Yeah,
that's good. Nobody enjoys having to go through that stuff. No. But it's nice that we have very high quality physicians who are able to take care of us.
Yeah, I was leaving the hospital the next day, and Dr. Caesar was going out, and I told him I was a bit of a difficult patient, and I said that I would race him out of the hospital, but
He won.
Yeah,
He knew better, right?
that's right. So there are some other things going on. It's not just new doctors, but you have different programs.
Right.
And we've been talking about the lifelong health events, which is taking place in Saybrook and in Chardon.
Well, actually, the one that I'm going to focus on here that is for Conneaut and Geneva is the one that we're doing at Andrus Banquet Center in Ashtabula.
Okay.
It's on West Avenue, and that is coming up on
Saturday. I'm sorry.
It's okay.
Yeah.
It's on Saturday, October 31st, from 9 to 1. The doors open at 8 a.m. We will have free health screenings that day. The free health screenings include bone density, balance and grip, blood pressure, mini pulmonary function testing, glucose and cholesterol testing. Everyone who comes in will get a free gift at the door. We have a free brunch, a very healthy brunch. Actually, Tim Miola has been wonderful to work with in preparing. This is the second time we're going to be there. We've got some, a great little menu planned for everyone, and it's completely free. Then we're also going to have a lot of our newer physicians are going to be up, and they're going to be talking. We're going to hear from Dr. Perial. We're a little more in depth on some, issues that he can help address. We've got some of our new physicians, primary care doctors, will be on a panel. I will be grilling them with some really hard questions. The things that the people are concerned about, the things that we hear all the time. Every time we do one of these events, we always have a survey at the end, and we ask everybody to fill out that attended the event. What did you like? What didn't you like? Any suggestions for the next one? And I take a lot of those suggestions and I incorporate them into what we cover for the next one that we do. So
what were some good ideas that people gave?
Actually, some of the ones people wanted to hear a little more on arthritis. So Dr. Abby is actually going to be answering some questions on us on how nutrition can affect arthritis and things that you can do to change your diet to help ease the pain of arthritis.
Wasn't there just something today, when this is being recorded, at the hospital about arthritis?
Yes. Yesterday at the hospital we had an arthritis forum, and Dr. Abby spoke, as well as Dr. Arminda Lupanis, who is a rheumatologist out at Concord in Chardon. So she came out this way to talk to the folks. So it was a really nice, we had a nice day. It was a good presentation in the morning.
Okay. So some of the things are going to be is like grip. So does that mean like you got to hang from something?
No,
to see how long you
actually,
can do that?
our rehab.
Put a little fire underneath them.
It's not that hard. Actually, our rehab staff will be there. We've got somebody from Geneva and somebody from Conneaut from rehab that'll be there. And there's actually this little machine that helps that you hold, and you don't feel like you're really doing anything when you squeeze it, because I tried it, but it actually does test your grip. And then it helps them identify if you're having issues with grip. And if you are, then there are some rehabilitative things that they can do to explain to you, to show you, well, these are some things that you can do on your own at home to help improve your grip strength. And, as we get older, it's hard, you go to open the jar and you have a hard time getting it open or things like that. So they'll be able to assist them with some tools on that. But one of the things, the balance part of that is it's really important. We don't always recognize as we get older too that, we have issues with balance. And so they kind of help people identify if they're a little shaky. There's a couple little tests that they give them while they're just standing there at the table. They're very easy tests. Not that one, but it's the raising your leg kind of test and things like that. And it helps them identify if they're at risk for fall. And if they're at risk for fall, they talk to them a little bit about, well, do you have throw rugs in your house? You might want to move those. And things that kind of can help prevent injury down the road. So that's actually, one of the stations of free screening that people can come and talk to. And all the tables, actually, we either have a free screening or we have some little free giveaway that people can take away with them. They always love the little heart stress balls. I should have brought you one today.
Yeah.
I'll have to remember that next time I come. But the little stress balls, everybody loves those too. So it's really a great event. We also bring in some community resources. We're going to have a gentleman who'll have a table set up from the Cleveland Food Bank. And he will talk to people a little bit and help you assess whether you're eligible for maybe some type of food assistance. He'll talk to folks about that. And then we have about 20 other vendors set up as well. Your usual people like to see the home party vendors like Scentsy, the cupcake ladies will be there. We will have Aloha Hands. I don't know if you, Len Jury from Aloha Hands will be doing.
But you're going to have cupcakes there? Is that part of the...
They're little cupcakes.
Little cupcakes.
Well, it is on Halloween. It is on Halloween, so that could be your little trick or treat for the day. Okay. And then Len Jury from Aloha Hands Massage will be there doing free 7-minute massages for folks as well. So we really, it's a nice event. We feel extremely fortunate we're able to offer it to the community completely free. And that way, you know, they can come in, they can learn about some of the things that they're concerned about, whether it be cancer or cardiology or just general health issues that they want to hear about.
So they can just go in and talk to somebody though a little bit about...
Actually, Dr. Abby is going to have a table there that day. So the way it's set up too is there's general information tables, but the part where the physicians are up and presenting is pretty formal. You know, you can sit at the table, you can listen to the physicians. If they're talking on speaking on a topic you're not really interested in, you can always go back and visit the vendors, maybe finish up your health screenings if you want. Everything will be going on the entire time that we're there. But Dr. Abby will have a table set up that day where she will answer specific questions about nutrition and maybe what are some of the ways that you can kind of amend your diet to help your overall health. She's a big proponent of, she doesn't over-medicate. She doesn't want, you know, she wants to see what can we do to change your diet, to change your exercise, to change those factors to help improve your health. And if those don't work, and medication is the next step we need to take, then that's what we'll take together. But
I've seen kind of a trend just doing this show, the short time I have the doctors in, is in the past I've always thought the doctors, a lot of them, is not wanting to talk too much about shortcomings maybe that the patient has in diet and not exercising and pushing pills and stuff, and they don't really do that.
No.
I mean, they talk, and it seems like exercise is something that helps just about anything that can go wrong.
And it does. And I know you ride a bike. You know, you cycle like competitively, correct?
Well, I ride with a group. We're doing it tonight.
Competitive or not? That's a whole nother thing.
we're not supposed to be competitive, but I'm not going to let that guy get that far ahead of me.
So, but you know, we try to. I guess one of the things that they try to impress upon everyone, and I, you know, I'll be the first to say I don't always live by it either, is any little bit of exercise you can get every day. So even if it's, you know, when you go to the shopping center, you park your car a little bit farther away and take those steps to the door as opposed to finding the closest spot you can possibly find. Interjecting some type of physical activity in your day. Even folks with arthritis, we would do an arthritis class on Mondays and Wednesdays here at the hospital. And we've had many people say just that day that they get up and they get that movement and that extra movement, and they do use a little bit of hand weights and stuff, and they're not, you know, it might be 2 pounds that you move, but that's better than nothing. But you're right in saying that a lot of the doctors coming through medical school these days are coming with saying, you know, we've got to find a different way to help our population, and we have to address the issues of diabetes and obesity and heart disease, all those things that go with it. And exercise does play a big role in that, and also what you eat.
Right.
It's very easy to pick up food that is, you go through the drive-through or processed, it has a lot of preservatives. That's much more easier than trying to figure out a way to select the best fresh fruit and creating, good healthy meals all the time. But don't give up on it. It doesn't mean that every night of the week you've got to make sure you sit down and you've got your veggie and you've got your fish is one of the best things you can eat. I know it's difficult for families to be able to do that. Everybody's on the go.
Right.
But don't give up on it. A few times a week, make sure you set aside, for that.
So, and if you fail, that doesn't mean that, well, that's it. It's
No.
McDonald's every night now.
Right, exactly. I mean, I trust me, I understand that it's challenging. I'm that same road. I've been down that, so. But it's a great day. If you would like to schedule a reservation, because there is limited seating for this event, you will want to call 440-998-0999. 0680 and schedule your reservation. And say you've got a whole table of friends that want to go. One of you can make one phone call and say, I'd like to reserve a table for 6 people. You probably won't get a live person that answers that phone, so you can leave a detailed message and they'll just call back and confirm that they did get that information. Or, if you do get a hold of them, you can just say, hey, give me a call back. Here's my number. I want to schedule a reservation. Give us a couple of days to get back to you, though, because it's one of our community outreach nurses, and she's also in the community all the time doing education.
Right.
So she's not sitting in the office all the time, but she will get back to you.
So it sounds like it's better to call sooner than later.
Yeah. We're not quite a week away from the event. We're getting, about a week and a half. We're getting really close. I'm getting really nervous. I want it all to come together. But it's definitely, I would advise to try to get your reservations in before the end of the week if possible.
So you're the person that asked this doctor to come and that doctor to come? And
I'm that person.
And the Sensi person?
And all the vendors. We try to have a nice array of different community service vendors that are there, and vendors that women like to, we know you're taking a little time out of your Saturday morning, and wouldn't it be nice to be able to pick up something nice here or there, or, so we've got education, we've got screenings, and we've got some fun stuff as well, so it's a really great day.
Hopscotch, or what's the fun stuff?
No, well, fun stuff in the middle will be some special exercising to get your muscles going before the break.
Okay.
So we'll do a couple presentations. We'll have a little bit of exercising in the middle. Nothing too strenuous. We'll have a nice break, and then we'll finish out the afternoon. The really nice thing too is our vendors who come. We also don't charge our vendors to participate in this at all. We give them a table space for free. We do ask that they provide a raffle prize, so at the end we raffle off for everybody in attendance.
Right. I see that there is some. I know I had another schedule someplace that talked about that.
Yeah.
Okay.
So it's exciting. It's a great day. Everybody should come. Men, women, everybody.
Okay, and it doesn't matter what age. Some of this looks like it's more for older people, but their blood pressure can be. Hey, I got diagnosed with high blood pressure when I was like 25.
Well, you know what I think the really nice thing is we actually see families come. Siblings will come and they'll bring their parents with them. Which is nice because it's never too. You're never too young to really start learning about how to take better care of yourself. And a lot of what we talk about at this event is just the foundation of how you can live a lifelong healthy life for your whole life.
Right.
It's not necessarily, okay, now I'm 60, I better start thinking about what I'm going to do with my health. These are all things that, people in their 30s and their 40s should start thinking about.
Or, well, I got to the weight I want to be, so now it's back to...
Well, and it's not
fast food.
Well, that's not necessary. The weight you want to be, someone can be very thin and still have high cholesterol.
Yes.
And yet someone who could be considered obese could have very good cholesterol. So you really can't gauge it by that.
Right.
That's why it's important to make sure you have a primary care doctor, you see them consistently, you have all the, when you're 40, start having your mammograms. When you're 50, start having your colonoscopies, those types of things. And make sure that that you keep in touch with your doctor and they're up to date on your screenings to prevent anything in the future that may, become something worse. As a matter of fact, I just went yesterday and had a full body scan for skin screening because, those are just things you don't want to take for granted.
So you can do that?
I went to a dermatologist, correct. Dermatologists do that, yep. Took less than 5 minutes.
Because when I go to the dentist, and he's looking around, and he says, "Next time you go to the doctor, have this checked, and have that checked." And
Yeah. So those are all the types of things that should be, as we get older, those are things that should be part of your normal routine.
We do have a beach here, so.
We do have a beach, and the dermatologists do ask about sunscreen. So, but yeah. So those are the types of things that we talk about at these events. We want to remind people, put it at the forefront, and you're never too young, or never too old, or never too young to start learning, new things about the way to take care of yourself.
And get into good habits.
Exactly. Something else that I want to talk about too that we've got coming up this Saturday, October 24th, both in Conneaut and Geneva from 9 to 11 we'll be doing community flu clinics. So if you haven't had your flu shot yet, it's $20. And you can just walk in. We'll be doing it in the hospital lobby. Again, it's from 9 to 11. You can walk in, get your flu shot, and be protected for the season. So if you haven't had a chance to do that yet,
All right.
make sure you stop in and do that this Saturday, October the 24th.
That's in Geneva and
And Conneaut.
Yeah, it's $20 for your flu shot.
Yep.
I know the Conneaut Health Department's doing them. Somebody called today and asked about that. So.
Okay. Yeah, this time of the year, we all try to make sure that we're, getting everybody covered, because last year we had a really rough flu season. I mean, people were sick for weeks when they came down with it. So, and in this case, the older that you get, it is more critical that you get your flu shot, because a lot of times it turns into pneumonia, you end up in the hospital, and you don't want that to happen. It's definitely worth taking that day to get that shot and get it taken care of.
So everybody should get one?
Everybody should get one.
Okay.
I got mine. See, I've got my purple sticker.
Okay.
I've got my flu shot for this year.
Okay, because I've never had one, and I never had a problem with the flu.
Yeah.
But
I'm glad I did after last year. I'm glad, because a lot of people I knew that had not gotten the flu shot were sick for a couple of weeks. And some people can't. So there may be medical reasons, and if you are concerned, if you've ever had a severe reaction to a flu shot, definitely discuss that with your doctor in advance before you have it. But for the most part, everyone who is healthy and is able to get one should get their flu shot.
now the notice that came at the city health department was like, is there one that you can get up your nose or when you get a shot? Or is
The one in their nose is the spray, and that's the live virus. We typically don't recommend that for anybody who has any type of immunity issues already, who may be susceptible to something. We don't do those at the hospital. We strictly do the shots, which is not the live virus. So that's the one where you shouldn't say, I got the flu shot and I got the flu. It's not, you may get achy a little bit the next day or something. So we recommend, you take an ibuprofen or something to kind of relieve those symptoms a little bit. But when you get the shot, you don't get the flu from getting the shot.
Okay.
Yeah.
Okay.
Okay. Let's see what else we got going on. We got all kinds of stuff going on in the community. One other thing I want to talk about, we offer a stop smoking program at the hospital, and it's called Smokeless. Our next class actually will be at the Madison YMCA. We try to move them around throughout the community, so next month maybe we'll be in Ashtabula, and the month after that we might be in Conneaut, and then we might be back in Geneva, and we might be in Madison. So we have different locations that ask us to participate and bring it in. So that will be, again, that'll be starting in November. Actually, November 30th will be the first class, and there's a 1 week you go the first class, and then the second week you go 3 days in a row, so Monday through Thursday, the following. But if you'd like to make a reservation for that, and it is completely free, this is the first time we are offering this class completely free. The hospital purchases a kit, and before what we did was we just charged $45 to try to recoup part of the cost for the kit. But we're finding it is so critical that people stop smoking that we are going to offer this program free now.
Wasn't $45 about the price of a pack of cigarettes anyway?
Well, but yeah, I don't know, since I don't smoke, so I don't.
Well, I think
maybe a carton is $45.
I
don't know.
It's just as expensive, I'm sure.
But it's an addiction, and you do have to want to quit.
Right.
You can't. So we are trying to make it a little bit easier. So it is free. If you are interested in more information on this program, maybe you cannot participate in the one that's coming up in November, but you want to know maybe when the next one's going to be, so you want to be put on a list. You would call 440-415-0261. And again, that's for the Smokeless Stop Smoking program.
Be a nice Christmas gift for somebody.
Oh, would be. A
Yeah.
nice Christmas gift for yourself.
Well,
a good way to
yes,
quit
yes.
smoking.
Yeah.
Another thing that I just want to remind everybody about is we just had our Walk for the Cure in September, and it's a walk that we do. Geneva, Geneva is the primary sponsor. Obviously, Conneaut participates as well. And we do not receive funding from Komen. We did years and years and years ago. Komen's funding has gone significantly shrunk, so the number of recipients for Komen grants has gone down as well. So this was actually our 14th annual walk. We raised about $18,000.
Wow.
all of that money stays in the community. And what we use that for is women who maybe cannot afford to, are uninsured and cannot afford to have a mammogram. What we're finding is, the sooner you start having the mammograms, if something were to happen, the sooner you can detect, the better your chances of survival are. So we offer that program free, and because of the fundraising that we do through the Walk for the Cure, and we have a wonderful committee, we've got tremendous support from so many sponsors in the community.
Yeah.
We are very, very fortunate. Next year will be our 15th year, and we're trying to think how we're going to make it bigger and better. We've talked about maybe adding a 5K race to it, different things to try to really make it a big deal. But if you're interested in finding out if you qualify for this free screening, the number you would want to call for that is 440-998-0695. You can talk to Paula. Paula Koval and Lori Slimmer are our breast navigators for UH.
Right.
And
they were here a few weeks ago.
Yes, they were here a few weeks ago. You're right. They were promoting the walk. So they are the ones who help. And if you were to have a screening mammogram, there would be any issues that they would detect. They would help you navigate and help get coverage for you to proceed to the next step. Usually if there's an indication there might be something, the next step is an ultrasound. Right. So we don't just say, oh, you had your screening, we did the paperwork, now you're on your own.
Yeah.
We help you navigate whatever might need to happen. We work very closely with Simon Cancer Center to see are there other things that we can do. We work with Dr. Gohl in Geneva, who is a huge supporter of this program. And a lot of what he does, he actually gives us free time to do our free screenings when we have clinics. We do a clinic 4 times a year where you can just schedule an appointment and come in, and he actually writes the order and assists you in getting your screening that day too. So it's really a great program, and without the support of a lot of the people in the community and a lot of the businesses, we wouldn't be able to pull it off. So just want to remind everybody about that as well. Let me keep going.
No, go ahead.
Okay.
I just put my feet up.
I know. The other thing that we've got going on that we're pretty excited about, November is Diabetes Awareness Month, and we are going to be launching a diabetes support group. It's going to be the only one that's in Ashtabula County. So we are hosting 2 informational seminars at the Ashtabula YMCA. So we've got people in Conneaut, we've got people in Geneva. So what you'll find that we're trying to do is we find that Ashtabula can kind of be a central location for a lot of this stuff that we're doing. So if you live in Geneva or you live in Conneaut, we're meeting in one place. It's 14 miles from one location, 17 miles from another. So it's pretty close to halfway.
Right.
So at the Ashtabula YMCA has agreed to partner with us on this program, and we will be hosting on November the 16th, which is a Monday, 2 different support group information sessions. One will be from 10:30 to 11:30 in the morning, and then the second one will be from 4:30 to 5:30. So if you can't make one, maybe you can make the other. There's 2 different times. If you want more information on that, there's also a number you can call for that, or you can just walk in. You don't have to, say you find that morning, your morning's free, and you want to come and find out about what this support group's going to be about. You're free to walk in, but if you want to call ahead of time and reserve a spot, the number is 998-0680. And this will actually play off of, we do a lot of diabetes free education in the community now as well. We hold educational pieces in the hospitals, in addition to a cooking class. We do a crockpot cooking class that teaches folks about maybe who might be on diabetes the right way to cook and how to use your crockpot to create very healthy meals. And then we raffle off the crockpot at the end of the class, which is kind of neat. But Lori Slimmer, who is our certified diabetic educator for university hospitals here in Conneaut and Geneva, and Kelly McGinnis, who is an educator here out in Conneaut as well, they will be working together on this program. So we're really excited about that. We're really excited that the Y has invited us to come in and use their space and partner with us on this as well, because they recognize that, one of the ways to help us combat diabetes in the community is through, exercise and diet, and they've been very welcoming to support us on this as well.
It's a good place to exercise.
Yeah, it is. Let's see, I talked about some of our new doctors. One of the ones I didn't get a chance to mention yet, she's based out of Ashtabula, is Dr. Susan Ratay. And she started in the Ashtabula Health Center on Lake Avenue with Dr. Courtney Barroso. She is a family medicine doctor, so she will see young kids, she'll see babies, and she will see grandparents. So she runs the whole gamut. So she just started a couple weeks ago out there. She's got some extended hours into the evening. I don't want to quote her hours because I'm not exactly sure what they. No, and actually, no. She has about a 2-year-old now, so I don't think her 2-year-old would be too happy about that. But if anybody's interested on maybe scheduling an appointment to meet with her, if you're looking, maybe if you live out towards the Ashtabula area, or maybe you work out in Ashtabula, and it's easier for you to see the doctor out there. Her number is 964-3733. And again, her name is Dr. Susan Ratay.
Okay.
Anything else?
Why don't you, like, in 30 seconds or 2 minutes or 1 minute, review what's going on at the end of the month? At
the end of the month. Okay, again.
Lifelong Health event.
Yeah, our Lifelong Health event. We're really excited about this. This is the second year we're doing this. It's at Andrus Banquet Center, which is at 2259 West Avenue in Ashtabula, right next to Nappy's Roller Den. And we will be, it runs from 9 to 1. The doors do open at 8. All of the vendors and the screenings will be set up and ready to go at 8. The free brunch will be set up and ready to go at 8. You can come in. We prefer you make a reservation because we do have to have a head count, as well as we need to make sure that we've got enough tables set up to accommodate. So to make a reservation for that, you would call 998-0680, and we suggest you do that before the end of the week, just so that we can reserve a space for you. But as I mentioned, we will have glucose screenings, cholesterol, blood pressure, mini pulmonary function testing, so to see, are your lungs, are you getting enough air in your lungs? We will have, actually we'll have a table. Our cardiac rehab nurse over here, Cindy McKinley. A lot of people in the area know her because they've done, the phase 2, phase 3 programs through cardiac rehab here. She'll have a table, be talking about some of the programs that she's got going on as well. Balance and grip testing, bone density, which is always nice to check, especially for women. Osteopenia and osteoporosis tend to set in, so it kind of gives you a nice baseline reading. And what a lot of these screenings do, they certainly are not meant to replace your visit with your primary care doctor. They're meant to maybe alert you that something may be happening, and at your next visit with your doctor, you may want to talk to them about it. But it definitely is not meant to replace or diagnose what your physician is doing for you. And we'll have a lot of physician speakers on tap that day, mostly our new ones that we've been bringing to the area, so we're really excited to be able to showcase them as well.
Well, it's kind of interesting when you're talking about you can reserve a table, so if you've got a bridge club group or friends that meet for lunch once a week or something, you could talk about, because it's on a Saturday morning.
Yeah, Saturday morning, 9 to 1. Doors open at 8. We will probably start pulling. The plan is to start pulling the raffle prize winners at about 12:30. So everybody, it's a nice way to spend your morning. And if the weather was anything like it was this Saturday, it's probably a better way to spend your morning indoors, being entertained and having a good time. And it is nice. Like I said, we're extremely fortunate we're able to offer the entire program free to the community. We're extremely fortunate that we have physicians that are willing to take time away from their families and their morning to come in and help educate the community. And
this is at the Andrus Banquet Center on West Avenue in Ashtabula. There's also one in Chardon.
Same day.
Right, at 13,000 Auburn Road.
It's actually at NDCL, yeah.
Oh, okay, yeah. All right.
But come to ours.
Okay. All right. Well, thank you, Denise DiDonato. And she is the Business Development Manager, which means she does a lot of different things.
Yes, it does. All right. Thank you.
Thank you.